A very warm good morning to everyone. Wishing you a great day. I am Dr. Apoorva Salve, Junior Resident from Swargiya Dada Saheb Kalmik Smriti Dental College and Hospital, Nagpur, India. This is my institute. This is my workplace, Department of Periodontology. And this is Dr. Salman Ansari, my guide, my mentor, who motivates me and supports me at every step. Coming to today's presentation, that is novel drug delivery systems of Mimusops elengi in therapeutic management of periodontal and oral infections. As we all know, natural products are very important in pharmaceutical biology. Plants being an important source of medicine since thousands of years, Ayurveda has flourished that. One such medicinal value plant is Mimusops elengi. Mimusops elengi. So what is exactly Mimusops elengi? It is a large glabrous evergreen tree that is 12-meter high with a compact leafy head and short erect trunk. It is commonly found in all parts of India. It is also known as bulletwood, Spanish cherry or Indian medlar in English, buckle, malusari or bolsari in other Indian languages, and elengi in Malaysian language. Taxonomical classification is this, that is, its botanical name is Mimusops elengi. Then it comes under kingdom Plantae, the order Ericales, family Sapoteci, genus Mimusops, and species Elengi. Coming to the phytotherapeutic chemicals of Mimusops elengi. Here I'll be discussing all the parts separately so that its medicinal values are clear with each part. So the leaves of Mimusops elengi are glossy and dark green. They are 6.3 to 10 cm long, 3.2 to 5 cm wide. They are variable, elliptic, oblong, short or long acuminate, margin undulate, closely but faintly veined. The petioles are 1.2 to 2.5 cm. The phytoconstituents of leaves are hen-trichonane. Hen-trichonane is actually a chemical which cures skin diseases. It is beneficial in ulcers and also diabetes. Then carotene and luteol, they boost immune system. Quercitol, beta-carotene and D-mannitol, they're useful in skin disorders and mucous membranes. Then beta-cytosterol and beta-cytosterol beta-D-glucose, they helps in lowering the cholesterol. Stem bark. So the stem bark of Mimusops elengi is brown, non-aromatic and astringent. It is 15 to 25 cm long, 10 to 15 cm broad. They have vertical lenticels, cracks and longitudinal fissures on them. Their phytoconstituents are taraxerol, butylenic acid and spinositerol, sodium salt of betulinic acid and urosolic acid. So these all constituents have anti-inflammatory properties. The interesting thing is the stem bark of Mimusops elengi is of most important value, medicinal value uh, compared to other parts. So the second constituent is eicosane oleic acid or octadecanoic acid or vanillin and clindamycin. These also have anti-inflammatory and antimicrobial properties. Then farnane type pentacyclic triterpene. These have the cooling or astringent effects, and new gallic acid esters, which are characterized as phenyl propanoxyl gallate. They have antioxidant, anti-inflammatory, and anti-neoplastic properties. This is the structure of vanillin, which is derived from the stem bark of Mimusops elengi. Now the fruit of Mimusops elengi is very ovoid. It is 2.5 cm long. It is astringent and sweet. And the seeds are grayish, brown, solitary, ovoid, compressed and shiny. The phytoconstituents of fruit and seeds are quercitol, quercetin, triterpene, alcohol, urosolic acid, beta-cytosterol, alpha-spinosterol, Mimusops acid, mimunogenone, and pentacyclic tetrahydrochloric. These have anti-inflammatory and analgesic properties. Now, the flower of Mimusops salinga is sweet, acrid, oleaginous, and cooling, and they are astringent to the vowels. The phytoconstituents of flower are essential oil, beta-cytosterol and its glucosides, gallic acid, quercetin, and camphorol. We have already discussed its properties, and specifically, the flowers are used to make perfumes for the uh, good odor. Now, coming to therapeutic uses of Mimusops salinga in general. The leaves, as we have seen, all the chemicals, they have analgesic, antipyretic, antihypoglycic, and antibacterial properties. Then fruit and seeds, they act as expectorant, diuretic properties, analgesic, and anti-astringent properties. The flowers have diuretic, antipyretic, weak hypokalemic activity, and they act as cardiac depressants. Then stem bark have antifungal and anti-cariogenic activities, anti-nematocidal activity, analgesic activity, and they also act as a cardiac depressant. Um, there's a research article by Jafar Sheikh, Kashim and Naidu. They have experimented this Mimusops salinga on diabetic rats. So they have checked the protective activity of ethanolic leaf extract of Mimusops salinga LN on lipid peroxidation and antioxidant enzymes in these experimental diabetic rats. And they have concluded that there is a promising therapeutic value in prevention of diabetes by the Mimusops salinga leaf extracts. So these effects could be mainly attributed to its antioxidant properties as shown by significant quenching impact on the extent of lipid peroxidation along with enhancement of antioxidant defense system in pancreas. Now, we have already seen the application of Mimusops salinga in the systemic diseases. Now, particularly, will be focusing the applications of Mimusops salinga in dentistry. So, in dentistry, um, Basu, S.K. Smita, C. and et al. In 2015, in their study, they have formulated a herbal mouth rinse along with many other constituents, but the main constituent was Mimusops salinga, and they derived that from its bark aqueous extract, and they found it to be a potent plaque inhibitor and anti-inflammatory the actions against gingivitis. Then Kalitha D and Saikia C in 2004, they have said that chewing of twig of M. elengi is Dantapavana. Dantapavana in English means it is a dentifrice which cleans the tooth. Okay. Now the powder of dried flour is useful for cleaning the teeth. Means that twig as well as the dried flour, they both are used in cleaning the teeth. That is, they have plaque inhibitory effects. Then, according to V.K. Singh and D.K. Singh in 2014, the unripe fruit and seeds, they are used to fix the loose teeth. Then in Ayurveda by Bharat Gami 2007, they have reported to be used for the treatment of bleeding gums. The bark of M. elengi is an important ingredient for the Ayurvedic formulation used as tooth powder, that is Vajradanti, which is used commonly in rural parts of the India. Then hot aqueous extract of dry bark and fruit used as an astringent, and it is applied externally too. So it can be applied on gums and oral mucous membrane as well, as it gives astringent and cooling effect to the membranes. Then M. elengi bark chloroform extract showed prominent antibacterial activity in dental patients by display technique in the study by Hitesh Kedi et al. In 2018. Coming to the antimicrobial activity, and the research done by Dash S et al. In 2019, they have said that the methanol extract, specifically the methanol extract, was effective against these microbes that are Escherichia harmani, Staphylococcus pyogenes, Staphylococcus aureus, Bacillus subtilis, and Bacillus cereus. Then the chloroform extract of Mimusops elengi was effective against the same organisms, including Pseudomonas aeruginosa. And the benzene extract was effective against Staphylococcus aureus and Pseudomonas aeruginosa. They have done the microbial testing of this against these bacteria, and the results were found. Coming to the antipyretic activity, so the antipyretic effect of alcoholic extract of Mimusops elengi occurs in a similar fashion as paracetamol. This was proved by A. Purnima et al. In 2010. The anti-inflammatory activity also was proved by Purnima et al. In 2010. According to her, there are presence of flavonoids and saponins and other polyphenolic compounds which are responsible for its anti-inflammatory properties. The alcohol extract inhibited vascular permeability. Hence, the healing effect can be seen, and they inhibit granuloma formation, indicating its effect on the proliferative phase of the inflammation as well. So, the healing properties can be attributed to these reasons. Now, the systems which I have formulated for the use of Mimusops elengi in periodontal and other oral surgical procedures or uh, the daily routine procedures. So, I have used for these raw materials. The first one is the bark of the stem bark of Mimusops elengi, and this is the powdered form of the same stem bark. Now first, let's see the mouthwash formulation of Mimusops elengi bark extract. So, gingivitis is the presence of gingival inflammation without loss of connective tissue attachment, as we all know. And effective oral hygiene practices on a twice daily basis usually provide a sufficient standard. We usually do scaling and root planing and oral prophylaxis. Along with that, adjunct to that, we also prescribe mouthwashes. So the gold standard chlorhexidine mouthwash, it has its own side effects. Obviously, it's a gold standard. There's no competition to that till now, but it has its own side effects that are staining properties, foul taste, etc. So, if we substitute the chlorhexidine with other herbal products which has minimal side effects, so it would be beneficial to the patients. Therefore, I prepared a mouthwash using the Mimusops elengi bark extract. The bark was first powdered, then the powdered Mimusops elengi bark material was air-shed dried. I had taken 200 gram of bark extract. Then it was immersed in 600 ml of solvent. Aqueous extract was then obtained by removing solvent in vacuum evaporator at 30 degrees Celsius, and it was stored in sterile bottle at 4 degrees Celsius. So this is the mouthwash which I have formulated. I have named this mouthwash as Rinsops mouthwash, and it has been copyrighted in Copyright Office Government of India. So I have studied the mouthwash with a control group, that is chlorhexidine mouthwash, as it is a gold standard. So 30 patients each in group was taken. Then 15 ml of mouthwash 2 times for 2 weeks was prescribed to the patients, both in control group, that is chlorhexidine mouthwash, and test group, that is Rinsops mouthwash. The clinical parameters such as plaque index, gingival index, and tooth staining index were evaluated. And the results of my study were that both chlorhexidine and Rinsops reduced the amount of plaque and gingival indices. The chlorhexidine mouthwash has greater efficiency in reducing plaque and gingival indices compared to Rinsops, although the difference was not statistically significant. That means that Rinsops had shown effective results against plaque and the gingival inflammation, although it cannot compete chlorhexidine. Furthermore, chlorhexidine and Rinsops increase the staining and intensity of stain area indicators, yet the amount of intensity of staining in the use of chlorhexidine was more. And here also the difference was not statistically significant. So chlorhexidine gave more staining than Rinsops. Hence, the Rinsops here can be a winner for tooth staining. Now, according to literature by Deshpande et al. In 2010, it has an antimicrobial potential and against the salivary microflora. We have already seen it acts against streptococcus, staphylococcus, Pseudomonas aeruginosa. So this is that the Mimusops extract, acetone extract act against the salivary microflora. Then, according to Mystery K et al. In 2015, the methanolic extract has inhibitory effect on the biofilm. These have been already proved from the literature. Hence, the Mimusops elengi bark extract can be effectively used as mouthwash in the treatment of gingivitis after the oral prophylaxis procedures. Now coming to Mimusops elengi bark extract as local drug delivery. We know that local drug delivery are given for the periodontal pockets who the patients who are not willing for flap surgeries or who are not indicated for flap surgeries, they go for local drug delivery. So chronic periodontitis is defined as an infectious disease resulting in inflammation within the supporting tissues of the teeth, progressive attachment loss, and bone loss. Local drug delivery is indicated as an adjunct to scaling and root planing procedure for the reduction of pocket depth in advanced periodontitis. So here I formulated the local drug in the form of injectable gel. So the granules prepared that are 20 gram from the bark were soaked separately in the 100 ml of ethanol for a period of 48 hours with manual shaking. Now these granules were sieved through sterilized Wortman number 1 paper filter after straining through an autoclave cheesecloth and stored at 4 degrees Celsius for further use. This was then incorporated in gel-based QS in injectable consistency. I would like to tell you that all these formulations are being prepared in a reputed pharmacy institute, and we have formulated this in association with all the norms and standardization. Now coming to the methodology, the research work I have done for this injectable Mimusops gel. First, the preoperative picture, that is 5 mm pocket is seen here. Then the injectable gel was injected in the pocket. It was overflowed in the pocket so that a good amount of local drug is being deposited inside the pocket for its full effect. Then a periodontal pack was given over the same region. Periodontal pack was kept for 7 to 10 days, and then it was removed, and the probing pocket depth was seen after 1 month. So these are the two groups. Group A was injectable Mimusops salinide gel, and Group B was injectable placebo gel. A placebo gel was used to compare the Mimusops salinide gel. So the results were probing pocket depth in Mimusops salinide gel was improved in 1 month, 3 months, and 6 months subsequently. Also, CAL was seen to be improved in 1 month, 3 months, and 6 months compared to the placebo gel. However, here we need to compare the Mimusops salingai local drug with chlorhexidine local drug, as it is a gold standard. Further research is under process. So according to literature, the Mimusops salingai gel demonstrated activity only against Staph aureus and MRSA. This was a slight contradiction to the study. So 70% of ethanol extract has shown an anti-inflammatory, analgesic, and antipyretic activity. Now coming to the bark extract as an antimicrobial suture coating gel. Now, why a suture needs to be coated? So, we know there are incidences of surgical site infections. So, surgical site infections are the infections which occurs within the 30 days post surgery. It includes pus formation, pain, ulceration, and many other symptoms. So, many microbes are responsible for causing these surgical site infections, like Staphylococcus, Streptococcus, Pseudomonas. These are the three main organisms which are responsible for causing surgical site infections. So, as I've already discussed, Mimusops elengi has been proved to be effective against these three microbes, that is Staph, Strepto, and Pseudomonas. So it can be effectively used as suture coating gel for preventing these surgical site infections, as 4.78 to 10% of cases have been reported to have surgical site infections after the oral surgical procedures. So here, this is the topic of my thesis, the suture coating gel, which is still under process. I haven't got the result yet. The research is being done, currently ongoing research. So the treatment of persistent deep pockets using open flap debridement results in greater success. Sutures used in oral cavity are continuously bathed in saliva containing 7.5 into 10 raised to 8 microorganisms per ml, and it can act as a reservoir of microbes at surgical site, leading to the chances of infection. Therefore, the suture coating gel was made. So there are already antimicrobial sutures available in the market. I have just tried to formulate a herbal product, herbal antimicrobial coating to these sutures to prevent the infections. So the same procedure of formulation as local drug was employed in this gel, except for the consistency. In local drug delivery, the consistency was thin. Since we had to inject that, we wanted an injectable consistency. And in this suture coating gel, the gel base was somewhat thicker than the local drug. This has been also copyrighted in Copyright Office, Government of India. So to describe the method, first uh, we select the patients with persistent deep pockets even after the phase 1 therapy. Here in the preoperative picture, you can appreciate a pocket very well. Then a flap surgery is to be performed on the patient. Since I am from Department of Periodontology, most of the cases I encountered are of flap surgery. So I have done research on the sutures which are used in the periodontal surgeries or flap surgeries, but this coating gel can be used in other surgeries as well. So first the preoperative picture, then the incision was flap reflection was done after full debridement and scaling and root planing. When there's a time of giving sutures, we coat the sutures with the suture coating gel. Thoroughly, the sutures are being coated twice and thrice so that it aggregates on the suture material, and then the suture is given. After that, there is a placement of periodontal pack. So here the concentration of Mimusops elengi used for suture coating gel as well as LED was 1%, and for mouthwash it was 2%. So according to literature given by Gupta and Jain in 2011, they have said that this Mimusops salinga extract has wound contracting ability, wound closure time is good, tensile strength is good, and dry granuloma weight. So this refers to an effective healing ability of Mimusops salinga. Then Dash et al. In 2019 in their study concluded that the concentration increase of these extracts resulted in the increase of inhibition zone diameter values, resulting in increase in antimicrobial activities of extract. That means the more the concentration increases, there's a greater inhibition zone and there's more antimicrobial activities of the extract. So now, recently, Mimusops salingae has been used in caries as well, dental caries as well, and its gold nanoparticles in combination with Mimusops salingae are also useful in systemic diseases as well, and in the treatment of caries and some periodontal diseases. So to conclude my presentation, the bark extract of Mimusops salinga can be very effective as suture coating gel, local drug delivery, and a mouthwash. So these are my ongoing research. However, further more studies are required to prove the potential of this material. My take-home message would be that herbal substitutes, they must be considered as an integrative medicine owing to its minimal side effects and cost-effective nature, which might benefit the patients in long run. Thank you for the patience listening and your time. Thank you so much.